Did you know that medical bills are the #1 cause of bankruptcy in America? Yet almost 20% of millennials aren't even insured? Wild. Today we're talking about how to find the best health insurance and understand your coverage options. Let's dive in. Before you start shopping for health insurance, ask yourself some important questions. How often do you get sick? Do you avoid doctors like the plague, or do you get regular checkups? Are you on prescription medications, or do you have a chronic condition? Do you have any nagging injuries? Knowing your healthcare habits and needs is the first step in finding the right insurance. Now, let's understand your options. Some plans have a cheaper insurance premium but limit your choice of doctors and hospitals to ones within their network of providers. Those are called HMOs, or health maintenance organizations. Other plans that cost more but allow you to choose your healthcare provider from a larger list are called PPOs, or preferred provider organizations. If you get insurance through your employer, they may pay a portion of your premium while deducting the portion you owe from your paycheck. If you get insurance through the healthcare marketplace, you'll be billed for the premium separately each month. Remember, you must pay your premium every month whether or not you visit the doctor, or you'll lose your insurance. Now let's look into the plan closer. Pay attention to those key terms. Deductible, that's the amount you'll pay out of pocket before insurance kicks in. Higher deductibles usually mean lower premiums, but be prepared to pay more upfront. Copay, this is how much you'll pay upfront for specific services. So a general doctor's appointment could cost you $35, but an appointment with a specialist could be $70. And something like an emergency room visit could be upwards of $300. This also applies to paying for different medications at the pharmacy. These are paid whether or not you've met your deductible. It's basically how much the appointment costs before any tests or specialized services. Coinsurance, this is the amount you pay after meeting your deductible. It's a percentage of the healthcare costs, and it's often between 20 and 30%. Your out-of-pocket maximum. This is the cap or limit on the amount of money you have to pay for healthcare services in a year. If you meet that limit, your insurance will then pay 100% of all covered healthcare costs for the rest of the year. Lastly, make sure to check to see if you qualify for any state programs or subsidies. These are typically income-driven and can really help save some money. And a special shout out to my 26-year-olds. If you're getting kicked off your parents' plan soon, please remember that you have a short window to choose a new one. Do not wait until the last minute. Understanding health insurance might seem complicated, but with these tips, you're on your way to making smarter choices for your health and your wallet.